piriformis. Okay, so you apply your lotion normally, okay, around the lower back. Then you would, exactly as we did before, concentrate on circular efferage across QL and onto glute med. All the way through. Okay, then you would do your same knuckling through glute med. Okay, so glute med on top of glute max, knuckling through. Okay, a little bit of thumbs through QL, so a little bit of petrissage through QL and oblique just to release off through the lower back. Okay, then you come round to that same side. This is when you look at your piriformis release. So bend the knee, a little bit of rotation, so it's internal rotation of the femur, and then you find your centre point to find piriformis. Once you've located it, then you can use your elbow in there. Okay, so what out of 10 do we think is acceptable to cause our patient? 7. Yep, 7 is fine. So you can ask them, get feedback. As it eases off, move a little bit, and then alter that rotation until you feel like you're on the right place. Okay, so where should they get a referral if we get into the right place here? Yeah, down the back of the leg. Okay, they might get a little bit of localised referral up towards the top of the glutes as well, but mainly down through the leg. Okay, so we spend a bit of time just mobilising and working onto piriformis. Okay, if you don't want to use your elbow, you're more accurate using your thumb, that's fine, you can use your thumb. Get a little bit of rotation. Check through there. So that'll be a little piriformis, and then relax, and you'd repeat the same on the other side. Okay, so you're doing a comparison. Okay, so you've got about 20-25 minutes. Okay, happy with that one? Okay, non-specific lower back pain is, again, the same routine that I demonstrated when we first went through the back. So warm up the whole back through there. Exactly the same as I've just demonstrated there. So do your circular efferage. Okay, then you'll be knuckling into top of glute med. You see a pattern emerging because most of these routines are very similar. Knuckling to top of glute med. Okay, we can do some hold pressures through glute med. Okay, then we work through QL, so using our thumbs, just getting into QL a little bit more. Okay. Okay, we might have a little feel around PSIS. See if there's any tension through there. We can do some little thumb circles. Release that tension. Okay, then always keep flushing through the back as well. And then we might want to do some of our forearm stretches, forearm pressures. So block one on the top of the iliac crest, the other one underneath the ribs, and a little stretch. And once you stretch, you can come all the way up the back. And then release. So stretch out, really open up that tissue. And all the way through. Okay, so forearms apart, get a stretch. And then all the way through from there. Okay, then we can work on to QL a little bit more specifically. You might want to work with your fingertips in there a little bit more, so a little circular efferage through QL. Okay, and again flushing all the way through, and we come round and repeat the same on the other side. Okay, happy with that? Next one, glute med. So same sequence to warm up. So circular efferage. Okay, really kneading down, really knuckling down through glute med, all the way through. Okay, then from here I'd put my fingertips into glute med and just pull towards me, so get a little bit of kind of static pressures through glute med, just underneath the iliac crest. Running through. So you can spend a bit of time on there, especially if you feel some tension. Okay, and then every now and then coming back to your circular efferage just to release. Okay, back into your knuckling, so you can repeat this as much as you need to, and back into those pulls. And then onto the same side. Okay, you're going to use your thumbs, and you're literally going to drag down through glute med. Okay, using your thumbs, dragging down. Okay, so your thumbs are going all the way through glute med. If you find a bit that's particularly tight, you can stop and hold your pressure. Okay, so we're kind of using the hands like that and coming down to mobilise through glute med. Okay, equally at the same time, because it's an area that we can put quite a bit of pressure on, I find it easy to lock my elbow into my hip, knuckle through my hand, and then mobilise through there, but I'm leaning my body weight through my hip. Okay, because if I'm just here, I'm going to get quite tired through my shoulder. So you can kind of lock your elbow into your hip and lean in to work into there a little bit more. Okay, to release off. Okay, and then obviously release all the way through, and then you repeat the same on the other side into that glute med and do a little comparison. Okay? Next one, QL. So warming up all the way through the back. Okay? Same routine, circular effleurage just to flush through, just to check where everything is. A little bit of knuckling out through glute med. Okay, then using your thumbs, almost like a petrissage lift, so just adjacent to the spinous processes, up through erector spinae, and then a little bit more laterally onto QL. So we're going to flush out initially on QL. Okay, then coming on to the same side, we're going to use our fingertips to do that circular effleurage or circular motions into QL. So just get off that lateral border of QL. Okay, and then when we find some tension, we can stop and hold. Okay, and then we can use our thumbs to work more specifically into QL. So a slightly oblique angle, and then really stripping through. Okay, and again, if you find an area of tension, we can stop and hold. So working between the iliac crest and the bottom rib. Okay, if I see you treating QL up here, okay, find out where your bottom rib is and stay underneath it. Okay, so really working quite specifically. We can use back of hands, you can knuckle in a little bit more. That's fine to kind of strip through. It does like a stretch as well, so I would always do it from the opposite side. So same as we did for the lower back, we can add on a little stretch. There. Okay, we can also add on a bit of a rotation stretch. So I'm pulling the hip towards me and lengthening up through QL. Okay, to mobilise. Then we can flush all the way through the back. Okay. Abdominal massage, that's going to be in there as a full routine. So learn it. Okay, it's the only one that I'm quite specific about with a routine. The rest of them, you can mix all the techniques together. Side lying back massage. I'll watch your side for me. Do you remember that? Same routine. So, warming up, effleurage through that top. So we're just working on this left side. Then we have to turn them onto that other side, so be careful of your time management if you get this one. And then we'll do our chasing hand, so thumbs just adjacent to the spinous processes. Kneading all that tissue, like a little petrissage and over obliques as well, all the way through. Okay, we can still work out through glute med, so we can knuckle out through glute med or use your thumbs, whichever you find more comfortable. Knuckling out all the way through. Okay, and then we can use our fingertips exactly the same, like little circular effleurage through QL in this position. Little circles. There. So we're kind of just doing lower back really here. Okay. And then we can do a little effleurage stroke up through erector spinae. Depending on how much they're uncovered, you can work all the way up through erector spinae. Nice horizontal, vertical strokes all the way up. Okay, we can also do a little circular effleurage up through erector spinae, all the way up. Just mobilise all the way through. Okay, so then we come up onto towards the upper back, so we can mobilise all the way around through the scapula, through the head, through the neck, all the way around. Okay, so we can work into rhomboids here, fingertips into rhomboids, mobilise all the way through. Okay, we've got lovely access into upper traps and levator scapula and into the neck here. So we can mobilise through here, or even stand from here, a little bit of a stretch on the neck, and we can work kind of back of hands or knuckles, or even thumbs into upper traps in that position. Obviously when the head's a bit more supported. Yeah. Okay. And then we can work through any of our scapular muscles, so supraspinatus, infraspinatus, all of that exactly as you've done before in your upper back massage. We can go all the way through, and then all the way around. But just be careful of your timing, because you're going to have 10 minutes on each side. Okay? Next one. Postural tension in the back. Okay, on your tummy again. Okay, so postural tension, obviously we're asking them where it is. Is it going to be lower back or upper back? For the sake of argument, we're going to say the postural tension is your lower back, because your next one is a thoracic kind of kyphosis. So we'll go for lower back tension. And the main thing with tension through the lower back is looking at their position of their lumbar spine. So if they're quite lordotic, we're going to need to put a towel or a pillow underneath them to make sure that their spine is a little bit more of a neutral position. Okay, so I would roll up a towel and place it underneath their tummy just to flatten out the lower back. Main thing with decreasing postural tension is you want kind of traction and you want a bit of space between the iliac crest and the bottom of the ribs. So all of your movement should be quite kind of gliding, quite kind of pushing your tension just to try and open up that space. So you'd warm up the back normally with all of your normal effleurage strokes. Okay, and then normal circular effleurage, so it's the same routine always just to start off with the lower back, all the way through. Again, always check glute med, knuckle into glute med to warm up. Pectorsage, again thumbs through erector spinae and onto QL. Okay, and then we want to, in fact I'll come on the same side. On the same side, you want to be almost with this hand blocking it with the bottom hand and really trying to stretch out through that lower back. So stretching out, really trying to open up that space between the iliac crest and the bottom of the ribs. Okay, so I can use my thumbs, kind of stretching out as much as I can, all the way through, getting rid of any kind of compressive tension in the lower back, stretch through. And then onto the PSIS, again, pressuring down, trying to open up that space, taking the pressure off the SIJ. So just mobilise through there. Again, it will like it either a cross-handed stretch on this side, or you can lean over and do the forearms, whichever you prefer. Get that nice stretch to release. Nice kind of gliding movement. Okay, and then you can do thumbs, little circular effleurage up through erector spinae, all the way through, or use your fingertips, again whichever you prefer, just to mobilise. But make sure that your finishing movements are nice kind of stretching, gliding movements through there. Okay, and then your last one is your thoracic kyphosis. So similar sort of thing, but obviously up towards the thoracic spine. So warm up the whole back. And then we're going to focus on this area. I know we kind of did this with your upper limb, but we're looking more at the spine here. So come all the way up, and then we'd be looking at mobilising all the way through the erector spinae on either side. So circular effleurage through the hands, all the way up, and that nice kind of sweep out through the scapula. So circular, all the way up through the erector spinae and sweep out. And the main thing we want to do here is take tension away from the kyphosis. So we're using our thumbs from the spinous processes and pushing out. So pushing out into rhomboids, very similar to the routine you would have done for your upper back before, pushing out into rhomboids. Okay, and then obviously you do the same on the other side. So a little circular effleurage all the way up through erector spinae, and then pushing out into rhomboids. Okay, all the way through. Okay, lots of kind of kneading movements around the spinous processes, or just adjacent to the spinous processes, that will help this. Okay, so up through erector spinae, and then pushing out into rhomboids. If you want to go over into upper traps and into the scapula, that's fine. You can release through the tension through there, but your main focus will be kind of on that central area. Okay, all of those make sense? Pretty similar routines for the lower back, you're just adapting depending on which muscle group you're working on. Okay, so I'm going to give you your logbooks now to have a look